and a bit of common sense has to be the way to go when you sit in the OP, especially when the junior residents sit in the OP and start their career to be an ophthalmologist. They have to apply their discretion, especially with lot of gadgets available. They should see the patient and spend a few minutes with them to hear the real problems and channel their investigations through that way, rather than sending the patient for each and every investigation to complete the process. In this way, they can personally follow up the patient and try to diagnose the condition. And for this, we have none other than Dr. Mallika with her talk on cultivating good clinical sense. Over to Mallika.
Thank you, sir, and good morning once again. Sir William Osler once said, "He who studies medicine without books sails on uncharted sea, but he who studies medicine without patience does not go to the sea at all." And that is what I am here to tell you, cultivating good clinical sense. Have you heard of broad specialties? Radiology, ophthalmology, anesthesiology, and dermatology. Because these subjects are not much stressed during our MBBS period. So for the first day of a PG, it's very difficult to cope up with. And they need they need much of hand holding. So, but I don't think so, because I consider ophthalmology is a highly privileged subject, because we are dealing with fairly healthy patients, can see almost all parts of the eye and around, and can come to a clinical diagnosis with ease. The clinical skills a resident should acquire are physical examination skills, practical skills, communication skills, clinical reasoning skills and diagnostic skills, treatment skills, and documentation skills. The first year PG comes, first day, he is seeing the OP, it is too much crowded, so much of sophisticated instruments and diagnostic techniques. He is so confused. How am I going to acquire all these clinical skills? How to use the new tools of examination? But don't worry, my dear students, it is going to be a metamorphosis from a glorified house surgeon to a clinician or a specialist. So the first few days, you will be sitting with your senior or standing behind your teacher, and two things you should do is how to talk to your patient and how to examine your patient. You observe, observe, and observe. Learn from the teacher and the seniors. And whatever new things you hear or see, try to note it down. You go back and read. And try to learn at least one new thing or a concept per day. And by that procedure, you will start enjoying every moment of seeing the patient and keep track of your patient. I should recommend you should read the Parsons disease of the eye. Nothing can match it, especially the section 3. Be ready with your armamentarium. Don't find it difficult, or don't feel it bad to buy all the necessary instruments for your PG period by yourself. During the first month of your life, you are mainly posted in the OP. But what will you do in the afternoon hours? You can diversify yourself to ward consultation, casualty, and grand rounds, etc. What will you do is you follow your seniors. You go to all these stations and observe the procedures and the documentation. That is also very important. You go to minor OT, ward consultation, even for the ROP screening, you can go with them. And once you start doing again and again, so you see more and more patients, go back and read and expand your knowledge by utilizing the library, you will develop your clinical sense better. And you should spend at least 1 hour per day of reading to begin with. But at the same time, you can remember that you cannot define your residency hours. That is the word of caution. And by the end of first year, you should start using slit lamp, indirect ophthalmoscopy, and 90D regularly. And then the second year comes. It's a time to widen your theory and make a provisional diagnosis, improve your communication skills and documentation skills, and it's a time for your specialty posting. And you must have started practicing steps of surgeries. How will you connect book knowledge to patients? You gather information from the patient, you have got the book knowledge with you, and you apply your clinical reasoning to make the diagnosis and treatment. You should properly plan your specialty posting. You should make use of the posting to learn each subspecialty in detail. There are so many investigations and instruments concerned with each specialty. You should be able to work on them. You should be able to run them independently and start doing the interpretations by yourself. You practice reading of X-rays, CT scans and MRI when you are posted in those specialties. Learn to do proper workup for specific diseases. And also you should ask which is the most common cases in each specialties. That is also very important. And this is also very important for your future. You can plan your subspecialty of choice. And don't think that, don't neglect the refraction, as sir has beautifully quoted it, thinking that it's very difficult and anyway autorefractometer is there, but it is your bread and butter. Be familiarized with vision checking devices and the vision testing techniques from the initial day itself, and practice retinoscopy and refraction, especially in children, and follow up and do the PMT by yourself. Another important thing is documentation skills that is very quintessential throughout your career. You should know how to write the admission ticket, how to fill up the front page and the clinical examination page of your this case sheet, and how to take a consent and post-operative notes to be written, and the consultation record when you are making a cross consultation, and also when you are referring a patient to a higher center. And now the third year comes. Now you start doing full workup, including suggestions for treatment. Be careful to do case discussions in ward specialty clinics as well, and be thorough with the refraction techniques. And don't have the feeling that you are relieved of all ward duties by that time, and start preparing for your examination. In nowadays, it was what sir has mentioned. It was from the teachers and from the textbooks only we gathered all the clinical sense. But the pandemic has opened so many platforms in front of us. You have got the AOC proceedings and iFocus Online and the PG class by Arvind Eye Clinic, and our KSOS is also doing wonderful job. You have to make use of all these platforms. And you must have seen that our own Gopals are coming every week with a case discussion with 2 to 3 eminent teachers. How can you escape from learning ophthalmology? How can you escape from him? So, being said all these things, don't think that you have to get confined to the clinics and theory, but you should get diversified. Find time to elaborate and to develop your passion and talents. So, children, now you have metamorphosed, your metamorphosis almost done. Then now you know how to talk to your patients, how to examine your patient, giving due respect to their anguish, how to work with and respect your juniors, seniors and colleagues, and how to do an ethical practice. And after some time, you yourself will tell me that let's make ophthalmology a fun. Thank you so much.